Multiple sclerosis (MS) is a chronic, autoimmune disease that affects the central nervous system (CNS), which includes the brain and spinal cord. In MS, the body's immune system mistakenly attacks the myelin, the protective sheath that covers nerve fibers. This damage disrupts the normal flow of electrical signals in the CNS, leading to a wide range of symptoms that vary from person to person. Key features of multiple sclerosis autoimmune MS is considered an autoimmune condition, where the immune system attacks the body's own tissues, particularly myelin. Chronic and progressive MS is a lifelong condition that can progress over time, although the rate of progression varies. Demyelination: the loss of myelin slows or blocks nerve signals, leading to symptoms related to muscle control, vision, and sensation. Relapse and remission: many people with MS experience periods of relapse flare-ups of symptoms followed by periods of remission, partial or full recovery of function. Types of multiple sclerosis MS can be classified into four main types, depending on how the disease progresses. Relapsing remitting MS (RRMS), the most common form, affecting about 85% of people with MS. Characterized by periods of new or worsening symptoms, relapses followed by periods of partial or complete recovery remissions. Secondary progressive MS (SPMS). This form can develop in people who initially have RRMS. Over time, symptoms worsen steadily, with or without relapses or remissions. Primary progressive MS (PPMS) affects about 10 to 15% of people with MS. Characterized by a gradual worsening of symptoms from the start, without distinct relapses or remissions. Progressive relapsing MS (PRMS), the rare form of MS, characterized by a steady progression of symptoms along with occasional relapses. Symptoms: MS symptoms can vary widely depending on the location and severity of the damage to the CNS. Some of the most common symptoms include fatigue, one of the most common and debilitating symptoms, often not proportional to physical activity. Numbness or tingling, often affects the face, body, arms, or legs. Muscle weakness, difficulty with coordination and movement, leading to problems with walking or balance. Vision problems, blur vision, double vision, or loss of vision in one eye, often caused by optic neuritis, inflammation of the optic nerve. Spasticity, muscle stiffness and involuntary muscle spasms. Pain, neuropathic pain, burning, sharp pains or musculoskeletal pain from muscle weakness or spasticity. Dizziness and vertigo, a sensation of spinning or unsteadiness. Cognitive impairment, problems with memory, concentration, and problem solving. Bladder and bowel problems, urinary urgency, frequency, or constipation. Sexual dysfunction, reduced libido, erectile dysfunction, or difficulty with arousal. Symptoms can worsen temporarily due to external factors like heat, stress, or infections, a phenomenon known as Youth-Off phenomenon. Causes and risk factors: the exact cause of MS is unknown, but it is believed to result from a combination of genetic and environmental factors. Genetics: while MS is not directly inherited, having a family history of MS increases the risk. Specific genetic mutations may also play a role. Infections: certain viral infections, such as Epstein-Barr virus (EBV), have been linked to an increased risk of MS. Environmental factors: geography: MS is more common in regions farther from the equator, possibly due to reduced sunlight exposure and lower vitamin D levels. Vitamin D deficiency: low levels of vitamin D, which plays a role in immune function, are associated with a higher risk of developing MS. Smoking: smoking increases the risk of developing MS and may worsen the progression of the disease. Gender and age: MS is more common in women than men, 2 to 3 times more likely, and typically develops between the ages of 20 and 40. Diagnosis: there is no single test for MS, and diagnosis is based on a combination of clinical evaluation, imaging, and ruling out other conditions. MRI magnetic resonance imaging the most important tool for diagnosing MS. MRI can't detect lesions, areas of damage in the brain and spinal cord caused by the breakdown of myelin. Lumbar puncture spinal tap. A sample of cerebrospinal fluid (CSF) may be taken to look for signs of inflammation and the presence of oligoclonal bands, which indicate immune activity in the CNS. Evoked potentials. Tests that measure the electrical activity in the brain in response to stimuli such as visual or auditory signals can help detect damage to nerve pathways. Blood tests. To rule out other conditions that can mimic MS symptoms, such as infections or autoimmune diseases like lupus. Treatment. There is no cure for MS, but treatments can help manage symptoms, reduce relapses, and slow the progression of the disease. Disease-modifying therapies (DMTs). These drugs aim to reduce the frequency and severity of relapses and slow disease progression by modifying the immune system. Common DMTs include injectable therapies, such as interferon beta and glatiramer acetate. Oral medications, including fingolimod, teriflunomide, and dimethyl fumarate. Infusion therapies, such as natalizumab, ocrelizumab, and alemtuzumab, used for more aggressive forms of MS. Steroids. High-dose corticosteroids like methylprednisolone are used to reduce inflammation and shorten the duration of acute relapses. Symptom management. Physical therapy, to improve mobility, balance, and muscle strength. Medications for specific symptoms, such as baclofen or tizanidine for spasticity, gabapentin or pregabalin for nerve pain, and modafinil or amantadine for fatigue. Bladder and bowel management, using medications or behavioral techniques. Lifestyle adjustments. Exercise. Regular physical activity helps improve strength, flexibility, and overall well-being. Diet and nutrition. A balanced diet with adequate vitamin D levels is recommended. Stress management. Stress can worsen MS symptoms, so stress reduction techniques, such as mindfulness or yoga, can be beneficial. Emerging therapies. New treatments are being developed, including stem cell therapies and experimental drugs that target specific aspects of the immune system or promote myelin repair. Prognosis. The prognosis for people with MS varies widely, depending on the type of MS and the individual's response to treatment. Many people with relapsing remitting MS/RRMs go through long periods of remission with minimal disability, while others experience more frequent relapses and steady disease progression. While MS is rarely fatal, it can lead to significant disability over time, especially in more progressive forms. However, with advancements in treatments, many people with MS can lead full and active lives. Complications of MS may include mobility issues. Difficulty walking or maintaining balance can lead to the need for assisted devices or even wheelchair use in severe cases. Infections. Bladder infections or pneumonia due to reduced mobility and weakened immune function. Depression and anxiety. These are common among people with MS, especially as they cope with the unpredictability of the disease. Cognitive decline. Some people may experience problems with memory, concentration, or decision-making. Conclusion. MS is a complex and variable disease, but with early diagnosis and appropriate treatment, many people with MS can manage their symptoms and maintain a high quality of life. Ongoing research continues to provide new insights into better treatments and potential cures for the condition. Would you like more detailed information on specific therapies or managing symptoms related to MS?